the impact and importance of having a mentor. So, with a speech entitled, Eric, it doesn't matter too much if your patient dies, but never ever make a cabbage. Please put your hands together for Eric Jones.
Thank you. Before we start, can I ask Doan to record my talk if he can? Is that possible?
Yeah, recording now.
Yeah, okay, thank you. All right. Yes, the title, Eric, it doesn't matter if your patient dies, but never ever have a cabbage in your life. Now, I'm not going to be, most doctors are evasive when it comes to this topic, but I'm not going to be evasive during this talk. This advice came to me from a consultant who I was working with when I was a young doctor with about 4 or 5 years of clinical experience. And my mentor or consultant, she was a doctor who had about 40 years of experience, and she was much more experienced than me. The advice came after a ward round in the critical care unit. In the critical care unit on that particular day, we had a young woman who had been in a road traffic accident. And this young woman had a high neck or cervical spine fracture. As a result of this, she was paralyzed in both legs, paralyzed in both arms, and unable to breathe. Her diaphragm was paralyzed. So we had a group of doctors around the bed with a long discussion on how we were going to keep this lady alive in the long term by using sophisticated ventilators and sophisticated feeding tubes. So this discussion went on for some time, and eventually at the end of the discussion, my mentor, she piped up and said, well, really, we need to examine our situation here because maybe we're going down the wrong path. And maybe we should be giving this patient just palliative care. And if she dies, well, then the husband can get on with his life and the children can get on with his life, and the husband can be a father to the children and they can have a normal life. The husband may even meet a new wife. At the meeting, there was another junior doctor, about the same experience as me, but his father was the professor of obstetrics. And because of his father's position, he had the idea, his importance was a bit more than the rest of us, despite his limited experience. So he piped up and he said, no, this lady's alive and she's conscious, and we've got to ventilate her and do everything to give her as long a life as possible. So because of this chap piping up with his ideas, which may have been based on his religious background, it created a very awkward situation for my senior colleagues. And the result was that they had to go down the path of ventilating this patient and organizing long-term ventilation. It was an unfortunate thing because it meant that the children wouldn't really have a mother who could look after them properly. It meant that they wouldn't have a father who could look after them properly because he was going to be too busy looking after his wife on the ventilator. So it was quite a tragic position for these children. And it was a tragic position for the patient herself. She was going to undergo many years of torture and suffering. So how are we guided in this situation. Many people think that we should keep patients alive at all costs. Somebody like Michael Schumacher, for example, was kept alive and is now not in a very good state. But we do have some guidance from the oath we all have to take as doctors when we graduate. We all have to take what's called the Hippocratic Oath. And a lot of people think that this oath is all about maintaining life as long as possible. It's not about that. It's about two things. The first thing is you have to respect patient confidentiality. And the second thing about it is that your treatment must do no harm to the patient. Now, in the days of Hippocrates, things were very different. He lived in about 400 BC. And in those days, the doctors had opium, which is quite an effective drug. They had opium in their medical bag, but they had nothing much else that was going to have much effect on the patient. But nowadays, things are very different. Nowadays, we have lots of drugs for treating AIDS, and we may not be able to treat coronavirus, but we can treat cancer, and with very good effect. We can shrink down solid tumors so that they can be easily surgically excised. And there's just so many things that we can do in these recent years, but unfortunately, sometimes our treatment leaves us in a halfway house where we have a patient who is neither alive nor dead. These patients end up in neurological hospitals. And sometimes we can get agreement from the family or requests from the family that treatment be withdrawn. But that's a very rare situation to arise because normally there's one person in a family who insists on the patient being alive for their religious reasons. So the patient just goes on a long period of suffering. Or sometimes they're unconscious, so they don't realize that they're suffering, but they're depleting the national health of a lot of resources. So what I've learned from this mentor of mine was never ever have a patient in a chronic vegetative state. And I was lucky in my career that I've managed to avoid that. But I also learned that if you are in an awkward position and you've got somebody who forces you to make the wrong decision, sometimes you just have to step back and accept the wrong decision that you make. Thank you very much, everyone.
Thank you very much, Eric. I was a little bit delayed again there because I'm being somewhat evasive of picking up my role again, mostly because I have charged ahead, possibly due to the fact that work meetings usually allocated about 25% of the time they actually need. Once you get people started talking at work, it seems almost impossible to get them to stop. So if Dawn could please put a minute on the timer for us now, and if everyone could please send their feedback via the chat function to Eric, that would be fantastic.